another very important aspect of managing health, which is insurance. Now I'd like to invite onto stage Mr. Snehal Patel, the CEO and founder of MyDoc, to share with us his views on digital and connected health technology solutions and the evolving insurance landscape. Dr. Patel.
Thank you. Well, thank you, ladies and gentlemen, for inviting me up on stage to give you a couple of insights that we've been able to glean over the last several years of being active in the space. Insurance is now a relatively hot area for disruption. You hear about new deals and new companies launching almost every day, especially in the US, but now increasingly in Asia, to address what we feel is a very important issue. So I have to start off with the obligatory numbers so we can have a context by which we can have a discussion. So if you look at the Asian insurance market in numbers, I'll start off by sort of throwing this out there. It's actually really small. So it's always important to sort of frame a conversation properly. That last number is actually relevant. It's only around 10% of the market, right? So I think it's important when we discuss how big, how impactful any of these changes can be, we frame it. That being said, that number is a great number from the perspective of an entrepreneur and someone who's really active in the space, because we know how the script goes. We've seen it in multiple other countries. Asia is at the cusp of an explosion of third-party payers that are coming into the space to help provide insurance products for folks. And in particular, how that relates to healthcare is of huge interest, given the recent moves by lots of governments in the region to start to provide universal healthcare schemes to help provide at a very base level, upon which the private providers can come on and layer on their services. But just to kind of go through the numbers in toto, if you look at sort of the total increase in global insurance premiums, it's an appreciable increase. Almost $4 billion invested in insurtech in the last year. That's up from $2.5 billion a year prior. That's obviously a huge number, and it sort of speaks to why you're seeing a lot more articles about this space. But how does that all affect ultimately why entrepreneurs are interested in getting in the space and how that affects health tech and insurtech? Number one, you see insurance premiums increasing, and I think that's going back to what I said originally. When you have far richer programs that are being provided to end users, I mean, if you look in Singapore alone, the sort of providing the safety net has become a lot richer for folks, which allows increasing costs, and ultimately the third-party payers that have to manage that costs are passing those costs on to employers, to end users. But insurtech as a percentage spend globally in Asia is still kind of nascent. We're just at the beginning of Asia exploding on the space, in the scene. That being said, sort of went through a couple of these numbers as well, but in terms of the increase in the percentage of spend in the space, it's improving quite largely. And I think when we start to have these conversations with folks that are looking to start companies in the space, we really do focus on these numbers and say, look, it may be growing large in markets that are already saturated, but in Asia we have different issues that we have to deal with when it comes to healthcare. We need to understand, obviously, the macro numbers of a large elderly population, and how do you actually provide products that can help manage the risks associated with that. But also, how do we do it in a market where we're underpenetrated when it comes to the additional sort of the base level of insurance products. I think the last number is actually very important. Now, if you look at sort of the increase for insurers across as compared to inflation, you're running at 5 times higher than inflation when it comes to medical cost increases. So the bulk of the increase when it comes to premiums, et cetera, are all coming from increases in just baseline healthcare. And I think that's where disruption, which I think is a word that's always overused, but where interesting models can actually emerge to help address these challenges. Now, bad news is, all those numbers, if taken at current value, are actually horrible from the perspective of policyholders and insurers. But from an entrepreneur perspective, you've now got a pain point, and the pain point is what you're trying to address. And the pain point is very clear. It is, you have increasing costs. They're not being matched by products to help defray those costs. And that can't just be more insurance schemes. It has to be innovative models by which we can help defray needless and inefficient expenditures when it comes to healthcare. And as it turns out, the insurers are obviously very aware of this. When you speak to a lot of the folks in this market around Southeast Asia, they're on one hand very excited at the prospect of being able to increase penetration. Remember, we're at 10%. Singapore is much greater than that, but overall in ASEAN, that's new markets. Those are new people, new customers. On the other hand, they look at that and say, well, on the base of a much faster rising healthcare sort of baseline, how do I make the numbers add up? How can I actually justify increasing premiums 15% year on year on a base that's already pretty low? And I think that's where we've sort of benefited at MyDoc and other companies in the space by saying, look, there is a gap there in being able to sort of figure out how do I make sure that these insurance products and these insurers can come into the market, but we can help control their costs as it becomes pretty untenable. This brings me to the second part of the discussion, which is the healthcare revolution that has sort of gone initially in a very parallel track to the insurtech sort of explosion. Sort of two interesting burgeoning spaces that weren't speaking to each other, which is really what happened, I think, in version 1.0. Yeah, so healthcare, if you remove the insurance element, growing large in the sense that with the same sort of government schemes that are providing universal care, public establishments allowing access to care in markets that previously were untouched, you're seeing an increasing utilization. Well, that drives increased healthcare costs. So a lot of the stuff in this audience, I think you guys know, so I won't spend too much time on it. Which then, these are also numbers that I think we're all very aware of, has led to it's increasing burden. Whoops, something happened there. Well, increasing burden on the healthcare system, right? So overutilization, inefficient utilization of the resources that we have, and a need to come up with a different model. So what happened in the first go-around, in terms of how technology was sort of built to confront this, was healthcare tech 1.0, as we called it. Now, even the humble, as for the physicians in this room, you'd love the humble beeper. When that first came out, that's a relic of an age past, but still, it helped sort of speed up patient care. All of these different modalities were there to help sort of cut out the inefficiencies in the system, whether it's information access. Patients now come, which sort of is a bane of a lot of physicians, but actually they come informed. You don't have to start from ground zero. Spend a lot of time explaining some basic sort of concepts. Even telemedicine, when it first launched, sort of providing another way of second opinion services, et cetera. These were all sort of organic developments to help address what was, chronic inefficiencies in the system. Impact in healthcare, as I sort of mentioned, it helped propel it forward and made some incremental changes in terms of how patients and providers were communicating, helps cut out inefficient sort of loops. So that was the first sort of gap in the system. I think what's more interesting now, though, is this sort of next wave, 2.0 that's come out. And I think the 2.0 wave is really interesting because these are led by a lot of companies that are actually quite aware of a very different model. The 1.0 was very much a silo model, right? So like I look at a problem, I just create an app or a product to fix it, and I go after it. Sort of ignoring the complexity of healthcare that we know and love and hate at the same breath. The next crop of companies that have come out have actually started to say, look, you know what? That has only had some incremental benefits to be able to do. On a business perspective, yeah, it's easier for me to build an app that just does one thing, but does it really move the needle when it comes to cost? Does it move the needle when it comes to productivity? And I think the answer has been no. And that is why you're starting to see other companies that are doing things in the space that are integrating. And it goes to what Francis was just discussing earlier, this idea of interoperability, the ability for all of these different interesting models to start to coexist and talk. Is I think has been really the hallmark of this next wave. So whether it's wearable tech, you may have a Fitbit, but the Fitbit's talking to your Apple, your health app on your iOS device, which then connects to an Omron device. This interoperability becomes important. So portals are very important. Whether it's the Samsung or Android or Apple sort of ecosystem development, and the remote monitoring. There's a lot of talk about IoT and sort of how do we actually make sensors more intelligent to help monitor health without us getting involved. So impact on healthcare, yeah, I mean, the idea is that we're seeing cost effects. I would say that they're still pretty moderate at this point, but ultimately as the actual cost of those products start dropping, you're going to start to see effects because of defrayed visits or acute visits that are no longer necessary. So once again, going back to this idea of efficiency, how do I drive more and more efficiency into a system without having to build very expensive, capital-intensive structures like hospitals and increasing beds? And I think that's really what the key to what these things are doing. And so then let's take it to the next level. So what does 3.0 look like? And this is, I think, where all of these different forces start to come together and talk together. So now you have, a health tech ecosystem on sort of the 2.0 level that has now integrated. They're all speaking to each other. By no means are we there yet, and Francis made several examples of why we're not there yet quite. However, we now have another layer on top of that, which are the payers. So it's not just about providers and care coordination. It's also about how do I make sure that all of those different things are now matching up with the cost drivers that are actually really important. And I think that's where insurance has started to really look at this. Now, I'd like to note something that's really interesting about the Asian market as compared to the US or other markets where insurance is actually far more prevalent. Because of the way and the vagaries of reimbursement and reimbursement risk and all these sort of things, Asia is actually, the insurers are actually in a pretty bad spot. They don't have good data, to put it bluntly, right? So if you think about, and I'll give you an example. In the US, where I hail from and I used to practice, physicians bear reimbursement risk. So what that means is that you go to a doctor, you pay your copay, and you go see the physician, and you're done. As a patient, you're out, right? The physician then and his legion of administrative assistants have to then file the claim the money back from the insurer. And it's a real painful process because the insurer has really, at this point, if you think of sort of the relationship, the insurer has every sort of incentive to kind of deny the claim or make it be very, very difficult with the physician because the service has already happened, it's done, right? So what has happened though is that the insurers were very, very clear and exacting in the type of data that we're getting back. So ICD-10 coding, et cetera, took off ICD-9 before 10. The kind of claims data that insurers are sitting on in the US is actually quite good. Now, contrast to Asia, and we've all been to the doctors here. I, as the end user, theoretically bear the reimbursement risk because I'm the person who has to pay and claim. But think about it from the insurer's perspective. They're going to be much more reluctant to deny a claim for a basic, say, a GP visit, because they're just going to lose you as a customer, right? So they're going to be they're going to let a lot of things slide. Now, what that also means is the doctor here who gets paid cash and is done, they're not really incented to actually fill out a very exacting report. If you look at most claims, they're actually kind of not really good. So we spoke to the insurers. Most insurers are like, yeah, I look at our claims data and I can't really tell. Forget ICD-10. I don't even know if this is an acute or chronic condition, but I have to sort of pay it out. That's actually something that's lost in a lot of the sort of, the talk about insurance. We're like, oh yeah, it's great. No, but that's a fundamental problem, right? If you can't understand what your claims data is telling you, how are you going to price that risk, right? What you're going to do is what's borne out in my slide. This is why Asian premiums are going up at a much higher rate than in other markets. They're going to cover themselves. The actuaries are not going to lose money on this transaction. They're just going to charge you more. So I think what's really interesting about it is that companies that are thinking about getting into the weeds, really understanding that if you can't figure out getting the quality of health data, and this is not step data, this is actually the kind of stuff that's required to create actuarial tables to sort of price risk. If they can't do that, then you're sort of at a big disadvantage.